If I told you that the drugs behind Ozempic and Wegovy might also be protecting people from cancer, would you believe me? Because this week, researchers said exactly that. And the headlines have been everywhere. But as a public health nutritionist, when I see headlines this big, I read the actual research. At ASCO, researchers looked at 12,000 people. Those taking GLP-1 drugs were significantly less likely to see their cancer spread, a meaningful reduction in progression. This isn't just a headline, it's a massive shift. Stay with me because what the science says and what the internet is telling you are two very different things. Let's look at what the science found and what it means if you or someone you love is taking a GLP-1 drug right now. Now, I want to be specific here because the internet is already blowing this out of proportion. The findings were strongest for 4 cancer types: lung cancer, breast cancer, colorectal cancer, that's bowel cancer, and liver cancer. These are all cancers that have a known link to obesity. That matters. And I'll explain why in a moment. There was also a striking finding about cancer receptors, tumors that had more GLP-1 receptors on their surface. Those patients had a 33% lower risk of dying compared to patients whose tumors had fewer receptors. For breast cancer specifically, that risk reduction was 45%. Those numbers are remarkable, but, and this is crucial, this does not mean GLP-1 drugs are a cancer treatment. We are nowhere near that conclusion. I will come back to this. Now here is where it gets really interesting from a public health perspective. Most people's first reaction is, oh well, people lost weight on GLP-1 drugs and losing weight reduces cancer risk. So of course. And yes, we have known for a long time that obesity is a risk factor for at least 13 types of cancer. Excess body fat promotes chronic inflammation, raises insulin levels, and increases estrogen in the blood. All things that can feed certain cancers. So of course weight loss helps. That part isn't new. But here is the part the headlines are not fully explaining. Some of the cancers in these studies, like certain types of lung cancer and even leukemia, are not typically associated with weight at all. And in the lab, when scientists gave semaglutide directly to cancer cells in a dish, it did not kill the cancer cells directly. That tells researchers something very specific. The drug is probably working through some other mechanism in the body. Not just by cutting calories or shrinking fat tissue. So what is it doing? This is the part that genuinely excites scientists right now. Your immune system is meant to act like a security guard for your body. Its job is to destroy cancer cells before they grow. But obesity appears to exhaust that security guard, making the immune system stop recognizing the threat. Remarkably, semaglutide appears to help reverse this damage. It helps the immune system recognize cancer as a threat again by changing how cells use energy. We are recalibrating the metabolism of the immune system itself. Now, this is early research, mostly from animal studies, but the consistency is significant. Let me be clear. This does not mean GLP-1 drugs cure cancer or should be used for prevention. The cancer risk from obesity doesn't just disappear with medication. As always, this is a conversation to have with your doctor, not with a YouTube algorithm. Consult a professional before making medical decisions. So let me summarize what we actually know. New research presented at ASCO 2026, one of the most respected cancer conferences in the world, found that people taking GLP-1 drugs like semaglutide had significantly lower rates of cancer progression in 4 major cancer types. A separate study of over 100,000 women found those on GLP-1 drugs were less likely to develop breast cancer. Scientists believe the drugs may work partly through the immune system, not just through weight loss. But these are early findings. We do not yet have the randomized controlled trials needed to call this definitive. GLP-1 drugs are not cancer treatments. They should not be prescribed for cancer prevention. And they do not replace healthy eating or movement. What they do tell us is that the relationship between metabolism, the immune system, and cancer is far more connected than we ever appreciated. And that is a genuinely exciting frontier for medicine. If this video helped you make sense of something confusing in the news this week, please give it a thumbs up. It genuinely helps this kind of evidence-based content reach more people. And if you're on a GLP-1 drug and want to know what to eat to protect your muscle mass and support your health, I've got a full video on that coming this Tuesday. Hit subscribe so you don't miss it. See you then.